Yeah, dear doctors, we are having.
Hello.
I invite Dr. Shreya Srinivasan to give a brief introduction about our speaker today, Dr. Bhuvaneshwari. Dr. Shreya.
Thank you, Doctor. A very good evening to all the iconic women here, and welcome to the fifth week of interactive online daily study sessions. And today, our respected speaker is Dr. Bhuvaneshwari. Dr. S. Bhuvaneshwari, ma'am, she graduated from the prestigious Government Homeopathic Medical College and Hospital, Thirumangalam, Madurai, and her journey in the realm of homeopathy began in 2007. Driven by a commitment to excellence and armed with exceptional skills, Dr. S. Bhuvaneshwari established Adiesha Holistic Homoeo Clinic in 2015, located in Chengalpattu, Tamil Nadu, near Chennai. Here, her focus is on providing personalized, effective, and natural healing solutions. What sets Dr. Bhuvaneshwari apart is that she's very dedicated to nurturing the next generation of homeopaths as well. With a wealth of immense practical knowledge, she mentors aspiring practitioners and shares many insights and expertise to shape the future of homeopathy and the practice of the aspiring practitioners as well. And her contributions have not just is restricted to the clinic walls, but there are many impactful case studies which have found place in reputable journals such as Hpathy and DARE, showcasing the depth of her clinical experience and success stories. Furthermore, there are many online articles which are published by her, which have transcended linguistic barriers as well, reaching a larger global audience through many translations in multiple languages. We are very grateful to have you here, ma'am, and we are looking forward to the knowledge that you are here to share with us. Thank you so much for giving us your time, and we request you to start your presentation. Thank you.
Thank you, doctor. Thank you, everyone. Again, I want to thank each and every people who gave me opportunity to present my case, to share my knowledge, because every time I believe sharing knowledge is sharing wisdom, which makes homeopathy to the next level. Homeopathy should not, if Hanuman have thought like that, homeopathy will be limited. We won't be enlightened and we won't be in the hands of safe future with a safe health. So I want to extend my boundary and my knowledge with my young budding homeopaths. That's why I am having my own group, which is not to influence anyone. I am maintaining that group through my Instagram as well as my FB, not through from anyone influence. Those who are willing can join from FB. The thing is that today I didn't present regarding the breast tumor case because she is under progress. I want to enlighten it after complete cure because whatever the case we are going to present, it should be completely cured. It should not be in the middle of the stage. That's why I didn't choose that case. In future, if we use the same topic regarding cancer's scope in homeopathy, definitely I will present the case because I am maintaining all my clinical case recordings because I am having my own website to maintain the blog. Here, the prostate cancer, I already posted in my website. I am having that blog case also with me with evidence. And the thing is that here, considering the age of the patient and the stage of the disease, allopathy doctor is not ready to give treatment because they are worried about his vital force. They are worried about the survival of the fetus because that man cannot survive, though he is not having any history of disease, any illness, any related with lifestyle disorders like diabetes, hypertension, or anything. Nothing. The first disease he got seriously is only this prostate cancer. The ailments itself is a very beautiful thing, which made me to choose Simlimum in an easier way. His emotions started from the deep rooted from the first son went away from home before, I think more or less before 1 year or 2 years. There the complaint started. You all know as a parent, though we have many children, we love the first child than anyone. Out of some problems, the first child gone away from him. Because of that, he started brooding. He is having three sons and one daughter. But still, he was very fond of, very attached with the first son. He went away from the home because of the family problems. This is the root cause, because in chronic stages of illness, in chronic diseases, especially in the syphilitic phase of any illness, you have to give more importance to the root cause of the ailments. There stands the first enlightening case taking evaluation. And the second thing, in all syphilitic cases, you have to give more importance to the any syphilitic illness happen within 3 months or 6 months. Again, there stands the second root cause. In this old man, before 6 months appearance of the cancer, he got severe UTI where he first passed hematuria. With that, he done urine culture, which was treated with a lot of antibiotics and get suppressed within 1 week. There he had E. coli growth with more colonies. This shows that he is going to get any type of syphilitic illness. That is also the another marker for the homeopaths to be remember that any type of, especially the terminal illness like cancer, tumor, or syphilitic, any syphilitic renal dysfunctions or liver cirrhosis or myocardial infarction in the terminal stages, you have to think about what has happened exactly within 1 week, 1 month, or within 3 months, or within 6 months. That past history of the disease is very important to rule out whether that particular patient is in the stage of psoric, psychotic, or syphilitic. Because stage of miasm is very important to find the simillimum, along with that to find the potency. Because in terminal illness, you should not choose mineral remedy or any animal remedy, especially when you are going to prescribe for the first time. Why I am telling this is these two kingdoms are very deeper remedies where you have to think about the stage of the disease and the vital force, how a man can able to accept the simillimum, whether it can be single dose or multiple doses or repetition of doses. So these are the cautious tips. You have to remember that with this ailments from emotions, I took that disappointment after the separation of the first son, the love he missed from the first son. Though he went away from his home, he was very much attached to his father, and this old man also very attached to his son. This is the first rubric I took. Other than that, his symptoms are after few months he started developing the symptoms of continuous passing, bleeding stools, recurrent fevers in the evening time, general malaise, want of appetite, complete tiredness, which are the common symptoms of the cancer. Along with that, even he started again passing hematuria with severe loss of his weight. Because of this, his family members took him to rule out what could be the cause for this sudden severe symptoms. After taking all the investigations, he was found out with prostate cancer, metastasis to the fourth stage, with the metastasis to the parts of spine, especially in the lumbar and sacral region, along with the rectum, bladder. These three things are involved along with the prostate. After considering these investigations, I will post these investigations in the group along with my PPT presentations. Sorry for the inconvenience because I don't know how to present the PPT as well as to do lectures. I feel that getting interrupted, my flow is getting stuck. That is the main reason for me to avoid PPT while I am narrating the cases. This is the particular symptoms. His physical symptom, I will start from the like organon case taking from sleep. Sleep is his first part of sleep is completely disturbed. He can able to sleep only in the early morning, especially from 2 to 4, because he is the man of whenever he is going to bed, he will immediately wake up in the early morning. As he is a village man, he want to take care of his domestic animals, and he is basically a farmer to take care of his land. So because of this, he will wake up, whatever could be the situation, he will wake up earlier. This is the sleep symptoms. After separation from his own son, he got scared more and he was very depressed, and he started brooding on his own. He can't be able to tell how he is suffering without the son's love. Whenever he get the chance to express this views to his own family members, they started shouting upon him, why you are thinking about him, because he didn't think about us, why you are thinking about him. This is the only statement told by his own family members. Because of this, he started brooding silently without telling anything, but he became very silent. Earlier he is very much I can't say talkative, but he is good in talking. He is a very helping nature. He is very empathy towards the sufferers. He is very much interested with the domestic animals. He is a good human being who always tries to help others. This is the real nature of that particular old man. Because of separation, he feel extreme tiredness. He started getting scary dreams that something is going to happen, misfortune is going to happen with his son. He is not alive. Might be he has died because he is a chronic alcoholic. Because of that, lot of brooding, overthinking of thought process. This is the sleep symptoms. Thermally, he is very chilly. He is very lean, emaciated. Even if we look over him, he looks like as if he is a very dark complexion. He is a very tall, slender, very emaciated, looks like a malnourished old man. Though only with the old age, he is not at all, he is not only became very lean after cancer, he is earlier also, his inbuilt itself is not obese nature. He is very tall, bony, and slender. Predominant facial features, which is also very important in considering the stage of miasm. That's why I gave importance to tell the physical appearance of that old man. Thermally, he was very chilly. As you all may know, in Tamil Nadu, all the weathers are very common, especially even in winters, we can able to experience the weather of only 25 or 26. More than that, it won't go low until unless then if it is a hill stations. So since he is staying in Chengalpattu, even in the winters, he tries to put sweaters. He tries to wear scarf. That much chilly. Even in summers, he prefers to take bath only in hot water. He is very comfortable without fan, even in the daytime, even in the summers. That much he is extreme chilly. Thirst, he is having very moderate taste, but he has the craving of drinking hot beverages. He is not an alcoholic person. He is a genuine personality. He loves drinking often tea or coffee, might be around 5 to 6 times per day. This is regarding the thirst. Sweat, though he is a chilly patient, he has sweat since he is avoiding fan also. Since he is a hard worker, since he is a farmer, he has profuse sweat all over the body, except palm and sole will be very chill and very dry. This is the sweat symptoms. This chilly nature is always there, doctor. This is the inbuilt personality. Since he might be lack of fat, he is very tall and bony, very slender and weak. This inbuilt chilliness is present. It is not common only to the syphilitic miasm, only with the stage of cancer. This is the inbuilt nature thermally. Sweat, And urine, as I already told you, the flow is normal, but hematuria is present after the cancer started. It is not continuous hematuria. The first urine is he had a hematuria. After that, in the evening, late evenings, he had. In between, in the daytime, he was very cautious to drink water. Because of that, he can able to control the blood in urine. Daytime urine 3 to 4 times is good. After late evenings, especially after 7 or around 8 p.m., he again started passing hematuria. He passes stool, diarrhea. I can't say it is completely watery. It can be colloidal nature. Along with that, started passing blood 2 to 3 times per day. He started passing stools. Along with that, bleeding stool present. This is nature of the stool. He is not a good eater. It is not this want of appetite also is not only related with cancer. It is a inbuilt physical symptom for that old man. He always a choosy eater. He eat only very less. He is very cautious in maintaining his physical health. That's why he is not a foodie type. He is a less eater. After the stage of cancer, his want of appetite has increased. Even a mouth fill of the stomach makes him to fill the stomach. He started developing of the abdomen very hard and tympanic. This is the abdomen symptoms. He craves, considering his in food items, he loves sweets like anything. Even in childhood, he had the habit of taking sweets, taking sugars, yeah, that sugar candies. I don't know in English what they will tell. That sugar crystals will be very big, no? We will use the offering puja for the god. I don't know in Hindi what they will tell. That also he eats more in his childhood, and he had the habit of eating ice cubes in his childhood. Because yeah, in ancient days and all, there is no fridge. We will buy ice cubes to prepare juice from the shops. No, they will store in the thermocol box. He had the habit of whenever his mother is preparing juice in summers, he will take one piece of cube and eat it by biting it. Such a craving for ice cube is present in the past history. Always remember that whatever could be the stage of miasm, whatever could be the stage of disease, whatever could be the age of the personality, you should not miss the childhood habits, childhood peculiar behaviors, because every person won't eat ice cubes in the childhood. So definitely this is very much peculiar symptom for this old man. That's why I gave more importance to this as a rubric also while evaluating the case. Urine, as I already told you, desire with the food. He always loves meat. He has the aversion towards the chicken and fish. In non-veg, he loves meat. He prefers any type of meat. It can be roasted, or it can be grilled, or it can be in biryani or whatever thing. He loves meat. He loves spicy, pungent, too much spicy, pungent foods, and he always prefers hot beverages and hot foods. He can't feel good if the food became very warm, or if the food become very much in room temperature. This is a peculiar desire for him. There is no specific aversions. As he is an old man, as he is from poor family, he eat everything. He will tell always to me, we should not waste food, whether we like or not. That is the thing he will always tell. The beauty of the thing is that he knows what he has the problem. He knows he has cancer. He knows what will impact in his body, but still he is very cool. He didn't even worry about what will happen to him, what will happen to the life. He is telling to me on the first time itself that doctor, I didn't worry about anything. Even if God is planned to take me tomorrow, I am ready to go. That is the willpower he had. I know everything what I am having. I lived happily for 79 years without any sorrows. I am ready to go if God is asking me to come back. That is the only statement. Again and again, he told me. This also I took it as a main rubric because he is very much looking positive, very much strong here, willpower. Because of that, I took that also as a main symptom to evaluate with the rubric along with the framing the totality of the symptoms. His past history, as I already told you, he had a recent infection of UTI, E. coli with more than 10,000 colonies. Before that, in his early age, he always had the problem of recurrent UTI and always had the problem of gastric indigestions because he is a fussy eater and he is not a regular following of a proper time of eating. He always, whenever he has the tendency of that, whenever we feel hunger, we have to eat. We should not eat before that or after that. That is the nature he gets. Sometimes he will skip the meal, sometimes he will skip the breakfast. That sort of nature he had. Because of that, he always have the symptoms of recurrent gastric irritations like burning sensations or related with vomiting or any type of food poisoning. This is the symptom he always had. So, because of this, he had these are the totality of the symptoms I framed. He was, I already told you the mental picture. He is very kind hearted, he is very humble, he is very much ready to help any people, help the needy people. Everyone is having a good opinion regarding him. Out of this, I framed the totality of chilly, strong willpower, ailments from starting off, root cause of the love, missing from the detachment from the son, gone away from him, craving for sweets, earlier history of craving for ice cubes, and desire for meat, uh, uh, moderate thirst, all the food he preferred hot, spicy foods, urine hematuria. The flow is very normal, but the urine with blood. And the thing is that evening rise of temperature and the insomnia part I took it because the first part of the sleep got disturbed and the second part is good with him. He is a good perfectionist in the way of whatever the time he is going to bed, he will wake up in the early morning. He is even while he was having illness, he was not at all bedridden. He is doing his regular course by going to land, by spending time with the domestic animals, playing with his own granddaughters. He is very much polite. Even he didn't even scold his son. He didn't even fight with his son. Even last week, one of the son beaten him. Even for that also, he didn't even think about badly. He didn't even curse his son. He didn't even beat his son. He didn't even complain this to me. Another son only said to me that my father has got beaten from him. He was in a continuous follow with me. With this, I have chosen Aurum Metallicum 30CH with a single dose. A good thing is that within 1 week I can able to see the difference. Since he is in the last stage of cancer, I asked him to tell whenever there is a positive sign or negative sign. So he always communicate with me through WhatsApp or through phone call whenever possible by updating his health. Mind blowing thing which has happened is that after giving RM at 30 CH within 1 week, his even I can't say 1 week, the next day his hematuria, bleeding stool completely stopped. Thanks to Hanuman and thanks to the universe, till 8 months he is under my treatment. He didn't even get the symptom of hematuria and bleeding stool. His back pain slowly got settled within 2 months. So that I am watching him with this case. I didn't even disturb with anything. In between, after 6 months, he developed the symptom of sudden hematuria, which has happened after 6 months. After taking the rule out of the emotional cause, what could be the reason for that sudden hematuria? With that, I able to gather the emotional root cause of. He was heard about that his elder son is staying somewhere. He wants to meet him. He started torturing his second son. Please take me to my first son. I have to meet. After because of his continuous asking, his second son took him to meet the first son, where unfortunately he can't able to meet his first son. He was not available in that particular day place. He was very much upset and he was very much disappointed. Because of that, again he started developing bleeding urine. Here I didn't choose an ornament. The reason is that the brooding started, but he became very much loathing of life, frustration of life, which is also a common symptom of the syphilitic miasm, which is also a common symptom of cancer. But I don't want to think about this thing as a common symptom of the miasm or the common symptom of the ornament. I want to take it as a peculiar symptom because he is such a strong man. He is very much willpower. He won't lose his positive nature, but he became very much bedridden. He worried about, he started even crying while narrating this symptom. Because of that, I gave him Natramure 0/1 in water dosage with repetition of every 6 hours once for only 2 days. Good thing is that after starting the first dose, his hematuria stopped. But to make this particular old man very stable, I continued Natramure 0/1 for 2 days with the repetition prepared from 100 ml, not preparation of multiple doses, only one poppy seed grain or Natramure 0/1. I mixed it and prepared it and gave to him in 100 ml water. I asked him again to dilute it by plussing method because to enhance his vital force without any suppression or without any aggravation. Because of that, he was very stable with one doses. For the safer side, I asked him to continue for the 2 days till today. This has happened around March. Now the June month started. He was very stable. Out of 8 months journey, I gave him only Oramet 30 ch 1 dose and Natramure 0/1 in water dosage with for 2 days with a repetition of 6 hours once. Thank you all for the wonderful opportunity. I will post the case with the evidence as well as the PPT within tomorrow. If any doubts, you can ask me. Thank you.